Hello everyone. We welcome you back to the next series. So we were talking in detail about pregnancy and all of that, but then there is a very basic problem, getting pregnant.
Yeah. Okay.
So you,
I think that's a very important point, and I guess you guys have a long list of things. I think a test to do when somebody presents with a primary infertility. And I think, again, going by the audience feedback, you guys have been talking more about probably the invisible factors. So the doctor comes back with a long list of test results, and they say the good news is that everything seems to be okay. But
and then what do you do?
So then that produces stress because everything is okay. There's something wrong with me. What do we do? Particularly from a mind perspective, I don't think there is a fixable solution. Just take this, drink this. There are so many options available there. A lot of people come up with concoctions to take, legumes to take, for instance.
Is it even there in the UK?
Well, they would have supplements, and the same principle applies, but they would have all sorts of things. But you have.
We call those masala drugs, no?
Yeah,
Sometimes we just have no answers. So then, so does the mind play an important role?
It looks like it does, doesn't it? If you
physically everything is okay.
Exactly. And I think one thing we need to really emphasize here is, even from the professionals, allow that conversation to happen. So you've done the best, and even as psychiatrists we do that. You rule out physical causes first, but don't stop. Continue. Let them engage in something much more relaxing and engaging with their own bodies and minds, to then allow natural things to happen. As we said, pregnancy is natural. Let's do the natural.
So is it the stress of they have to get pregnant in that month? Does it, because sometimes even we are not able to give them answers. Things are okay.
But so I guess it must have a role, shouldn't it? I think that is what I'm guessing. I'm sure there is something there.
So how do they condition their mind? What do they do?
Again, when you look
does yoga play a role? Acupuncture?
All of that is important, but I would say, fully engage in the process of getting pregnant, enjoy the process rather than thinking of an outcome as a pregnancy. Pregnancy is not the end sort of goal, I suppose. Don't think it is a task to tick off. You enjoy the process of baby making.
Does become a task.
Exactly. So you look at love making, then extending to then baby making. So I think if love making,
couples themselves say that it's very stressful.
Exactly. So, but then it shouldn't be. It shouldn't be, because if
do
love
we tell
making,
them to be mindful? Do we tell them to meditate?
Of course. So if you make love making pleasurable, enjoyable, and then involve sort of the baby making process in it, I think that takes a lot of stress away. So that's very, very important. And then also, finding time for each other, being a couple is really important. That's very, very important. But
are there techniques like you hear about cognitive behavioral therapy and all of those things?
Perhaps what we'll do is, there are certain conditions, particularly affecting women more than
anxiety
men.
Or
anxiety, stress, somatoform problems, depression. But we'll pick that up towards the end of the video. I'll probably discuss that in another.
Work pressure does.
Yeah, but what I would like to then go into, like you said, is once you have a baby, you've gone through a very difficult process of planning a pregnancy, falling pregnant, having a baby, and now it's time to go back to work and your regular routine life and all the other pressures that come with motherhood, parenting kicks in. And when people have a high-powered job, and I see a lot of women who are what we call as highly strung, maybe that's
Type A personalities?
Type A personalities, yeah.
Okay.
So they're very ambitious.
So they want to be best.
Yeah, they're very ambitious, rightly so. And they're perfectionists. They want everything to be done in a certain way. And that sometimes leads to hostility. Hostility at workplace, hostility at home, a lot of anger. So their wish to be in a certain way and accomplish certain goals is expressed as hostility. Then it produces a lot of negative emotions in the family. So that has to be addressed and being mindful. And this then causes women to not sleep well, not eat well,
and then it's a cycle.
Yeah. So you just
some couples also ask me, should I take a 3 months break or a 6 months leave, and will I fall pregnant? Mm-hmm. Is that a good idea, or do they? Is there an answer to that?
No, I don't think we should try and put it again into a prescription pad. We have to prescribe mindfulness. in that way. But we can't say
Which
3
is
months
how do you do in your day-to-day life?
Yeah.
How do you be mindful?
So the simple thing to do is think of you in that situation. So you being the listener, what would somebody tell you that would make you think about it? Because these days, no one wants to be told anything. If you want to know something, what do? Turn to Mr. Google. He's more reliable.
We don't want advice.
We don't want advice. So if you sit there, tell somebody something, if they respect you, they'll say yes in front of you, and then they'll do their own thing afterwards.
So like coming back again to the stress part of it. Yeah. So women work hard. They are now at high positions. They have their careers. And we also tell them the best time to get pregnant is between 25 and probably 30.
Yeah.
That is when even their career is at a peak.
Absolutely.
So with the stress, how do they be mindful and balance that? Is there a work-life balance from your point?
So when you look at, say, stress, eustress and distress, and we picked on this some time ago, eustress, useful stress.
Okay.
Useful stress. You need a little bit of stress to get up and going. Distress is when the stress starts affecting you.
So how do you pick that?
So it's be mindful of that. Anything that affects you, you wouldn't know that. You're eating a nice meal, you bite a chili, of course you know that. You will not be keeping on eating the chili, which unfortunately a lot of us do when it comes to chili. Because, there's a habit. Now, we can go into that in a great detail. We are sort of creatures of habit. We do lots of things which could be bad for comfort, addictions, many things. We don't even touch upon that huge area. So being mindful is very important, one. And two, when women have the autonomy, that's very important. Women should feel that they can make the choices against societal pressure. In fact, I would even argue that women place the pressure on themselves.
Yeah, are they always trying to please everyone and trying to fit into too many roles, and that causes stress?
That is a huge issue.
So what do we do then?
So I think it's not about doing something else. It's about once you're mindful of something, you wouldn't do it.
Because I think it starts even from a teenager in school wants to do well, college wants to do well. When it's their wedding, they want to look the best.
Exactly. But for me,
with all of that, and then,
talking to a woman about it itself solves the problem, believe it or not. It's as simple as that.
Who should talk to them then?
This is the problem now, isn't it? So anyone who is willing to talk to them should be tuned to that. Because most of us are in the position to say, look, this is a prescription. These are the rules to follow. I'm off. Bye. Hang on. Sit down. That doesn't work. So you say, look, sit down. What seems to be the issue? That question solves it. Because they know the solution. It's about bringing it out, bringing it to the fore. Very important thing.
So are there some tips you can give? Do they write down their day, or do some women just get stressed about the same thing again and again.
That again goes back to the type-As who want to do things in a certain way. And I would go away from all of that. If writing down things helps you, then that is for you.
Do it.
Do it. But don't think I've got 10 things to accomplish and I have to rush through it, and that produces extra stress. Yeah. And just generally create more opportunities. Have friends. Have more things to do. Don't get cocooned into one area thinking that you need to just excel in this. When you say balance, it's a bit of everything. Balance in nutrition, and same if you look at balance in life. Rather than reading a huge book on how to balance your life, you just say, have I got bits of everything in my life? A bit of work, working, spirituality, friendships, entertainment. So that we just
even during certain phases of their menstrual cycle, like PMS is something which
that is a huge issue. Of course, that's a huge issue.
Because as gynecologists, we just give them some prescription and diary.
Yeah, but I get a sense that I don't think gynecologists are very happy when women just come with some issues just around their menstrual period. They say you've got your menses, just go away. Because most gynecologists I know are women.
We are used to just seeing some disease and treating it, and that's
exactly.
it.
And this is a part of what they do. And for us, the statistics is staggering. 3 in 4 women who menstruate have some symptoms of premenstrual tension. Yeah. And apart from having the tender breast, joint aches, flu-like symptoms, general tiredness, you have huge mood fluctuations, mood swings. And I have a particular interest in productivity in women. And if you look at a working woman, and if they have 5 days of menstruation in their 30-day cycle, you're straight away taking a lot of time off. And if you look at a working week, and if they're having a 20-day working week, and 5 days off will be 25% of the time. So you are losing anything between 20 to 25% of your productivity. And that's a lot. And put on top of that the type A's where they want to do 125% rather than 75, you have a problem.
So again, is there a treatment plan, or a lot of mind and body?
I would say if you have
holistic?
extreme mood swings, we'll talk about a condition called premenstrual dysphoric disorder, which is a specific condition. I think we might have to put a slide on some of the symptoms to look for. That is a treatable condition and has to be looked into. There are several things people have been advocating. The two things that come to mind: hormonal changes, and some people do have a serotonin deficiency that has to be addressed. So these are real issues. Again, if a colleague at work or a family member is a bit erratic around their menstrual cycle, you can just not put down to PMS. Acknowledge it in a nice way. Hey, you may be having your periods. Hence, just take it easy. Don't make huge decisions.
But sometimes women also don't like to be told that,
Exactly, but it's important. It's like, when you're not very well, when your mind is not at the best possible situation,
rather not being snapping at everybody.
Exactly, you say
recognize. So is
recognition is very important. So awareness, recognition.
That's what we call as a menstrual diary. It's a prospective diary. We tell them, okay, if your period is regular, at one time you are going to be, either emotionally or, physically disturbed. Just keep a note of those
So from a
days
medical point of view, a couple of things. There are several vitamins. Vitamin E, particularly magnesium. Vitamin B6, for instance. Good nutrition, again, it comes back to the basics. And then you look at
yoga and exercise.
That's useful too, but some people also use oral contraceptive pills to regulate menstrual cycle. That regulates hormonal levels, I suppose, to a certain extent. And in rare cases, we do use antidepressants like SSRIs. But again, a lot of influence by mind on this, looking at, again, natural ways of doing it. And and don't let that become a problem.
Coming to a very, very basic, stupid question: what is the mind? Because again, we just see the brain, and we see something happening with the brain, whether it's infection or tumor. But
so mind is invisible. And mind is useful for you to feel what is happening around you and express the way you feel. So there are traditions which talk about mind being separate from the body, and the mind lives on even when the body isn't around.
And the mind is always either thinking or overthinking,
but then there are methods to then calm the mind. So teach the mind to stay calm, because it's the body and the environment that has fed the mind certain things to make it overeat.
If we know, if there's a very easy answer to that, you'd be out of business.
That's one. And two, there could be an easy answer, provided people engage with things in that way, because we are conditioned to use our body more. We're conditioned to behave more like machines than humans. So it's about rethinking
just sitting
the whole thing.
calm, and doing nothing. Is it easy? Nowadays?
No. Again, it's not about just giving rest to the physical body. It's about actively engaging the mind. So again, meditation is not about being silent or doing nothing. It is the most active time when your mind is really engaged. But it's engaged with something much greater than the mundane anxieties.
We also see this Ayush and all of that, which Department of Ayush and all. I think even AIIMS is having a department
it's good
like
that now people are beginning to think about much more broader than just stick to the brain or the heart, But that's another major topic, the heart, But heartfulness, mindfulness.
Let's talk more then, let's discuss more.
So this is a very interesting topic.
And coming back to PMS, recognize it, address reach out.
It's okay. It's
an
okay.
entity.
It's an entity, and it's here to stay. We can't ignore it.
But again, learn how to handle or manage.
And I would say one thing to the young women out there: don't be hard on yourself.
I know.
That's very important, because that's your body, it's your mind. You go through a lot of hormones. Deficiencies of nutrients.
Like I saw a slide recently on work-life balance, right? It's by a surgeon who says that probably I'm a better surgeon because I'm a good mother or a wife, and I'm a good mother and wife because I'm a good surgeon. So it's not these are not opposing forces. They have to work in synchrony with each other.
Absolutely,
So I guess we'll be talk more then.
Yeah, excellent. Yeah, thank you.
Thank you.